Hello, everyone. This is John Barry with the Department of Healthcare Policy and Financing. And we are here today, Wednesday, November 15th, for the Participant Directed Programs Policy Collaborative PDPPC meeting. And we are recording. So I would ask you all to be mindful of not sharing any protected health information, or which is PHI, you may have heard. PII, personally identifying information. I will just say that, well, let me see. I will ask Emily if we can scroll down to page 2, or the top of page 2 of the agenda. There is a list of agreements. These agreements were made, most of them, if not all, years ago, between stakeholders and each other, and also the department. They were actually drafted and written by stakeholders, in case you're wondering. And the purpose of these is to have a positive, professional, adult environment where we share opinions, share facts, share our feelings with each other. And they're not always pleasant. There are strong issues that we talk about here, issues that have to do with the health and welfare and safety of folks, and so we understand that. We ask people to be mindful of being courteous and respectful with each other. And as the facilitator, when I feel that's not happening, I will stop the action as immediately as I can, and we will see if we can get back on track. So thank you for that. I am going to be monitoring, as are other people, about having folks muted when they're not speaking. And so please don't take it personally if we mute you. We are mindful of background noise, because the background noise will interfere with the meeting and will bring it right to a halt. So thank you for that. Back up to the top, Emily, if we may. Thank you, and thanks for sharing your screen, Emily, and doing this. So I'm trying to think if there's any other housekeeping things. I cannot think of any right now. I will be asking in 1 sec for names of people who are on the phone only. I will be right with you. We've done the agreements. We are going to have 2 open forums today as usual, and a shorter, it appears, a shorter agenda, as shorter than usual. So now let me ask if there's anyone who's on the phone only, or those who cannot make use of the attendance link, to unmute and give me your name. I do see a familiar phone number, Ron Heller, Tracy Heller. I see your number, so I have you down.
Thank you, John.
And I saw Jerry Froney, looks like phone only. So Jerry, I have your name down. Anyone else who's on the phone only who wants to give us their name for attendance purposes? I'm seeing about
Dolores Hurley.
Dolores Hurley, thank you. Have you down, Dolores? Anyone else? So I have Dolores, I have Jerry, Ron, and Tracy. Okay, moving back up. Okay, open forum. Just as a reminder for folks who are new or perhaps don't recall it, the open forum is a time for people to share announcements, to ask questions of each other, and certainly you can ask questions of the department. This is not a time for a back and forth discussion as we have with agenda topics necessarily. We also do have a link for requesting topics to the PDPPC meeting, and I'm hoping that one of my colleagues or myself at the break, I will put that link into the chat. Right now we have the online attendance link. If you want your name to be recorded for attendance purposes, please fill it out. And there was something else I was going to say. The reason for the attendance is this is a stakeholder function. It's not the department keeping track. We have a stakeholder volunteer, Robin Stevens, who had been doing a fabulous job for many months now, keeping track of the attendance. Eligibility for voting when the group does vote on recommendations, for example, is determined by attendance. And this, again, is a stakeholder decision years ago that this is how folks would gain eligibility to vote on things, stakeholders. The department doesn't vote, vendors don't vote. So any names, anyone who's on the phone only? I see 2 hands raised for the open forum. Anyone else? You can unmute your phone by pressing *6. You can type your name in the chat. I see 2 hands, though. I have you down, so anyone else? Okay, I will put my name at the bottom of the queue for that open forum as well. Let's start with Jerry Froney. Jerry, good to have you with us again.
Right. I want to know why this meeting is so short, why it's listed as ending at 2:50. And if we had some holdover business from the last couple months, did that get on the agenda? I don't remember what that was, but I just want to make sure I understand why it's scheduled to be a short meeting. Thank you.
Thank you, Jerry, and I will address that. Let me just first do a little logistical thing here, Jerry. Bear with me, and that is that when Dolores spoke before and when you just spoke, the volume is pretty low. And I don't know if it's me on my end with my computer or if others are also experiencing low volume. So I guess I would just let me check in with Aaron or Emily or Jessica, somebody. Danny, are you experiencing low volume or is it just me?
I think it's just you. Looks like people in the chat are hearing okay as well.
Okay. All right. Thank you. Well, it's my problem, folks. I'll go to treatment for it. So, okay. Jerry, to get to your questions here, just as a reminder, we have a process where the stakeholder co-chairs, one or both of them, depending who's available, but at least one of them, and we get together on the first Wednesday of the month, and we plan out the agenda based on things that are going on, based on topics that have been requested, based on things that occurred in the last meeting. We don't always have 3 full hours of stuff to go over, and that is the case today. In fact, I would say this is a relatively shorter amount of time that we have than usual, but believe me, Jerry, and everyone, this is what we know that is on the agenda that needs to be addressed today based on our planning, along with Kurt and Kevin. So there was no other outstanding business that I'm aware of that should have been and is not on this agenda. And any of the other staff, if I'm wrong on that, you can certainly correct me, but was there another question, Jerry?
I'll just
I'm trying to think Jerry, if I missed one of your questions, don't want to make sure we don't. I don't know if you had 2 questions there or just the one.
That's fine, thanks.
Okay, Jerry, thank you. Kurt, I see you are chiming in. Please go ahead, sir.
All I was going to say, Jerry, is the meetings tend to get shorter, I think, because we're being more efficient. But anytime you want anything to be brought up, the open forum is a great time to bring it up. And then I make notes of it as well and bring it up as part of our pre-planning. So, and that goes for anyone. If you got anything going on, now's a great time to at least throw it out there so we can get it on the next agenda and make things happen for you. All right. Thanks, John.
You bet, Kurt, and thanks, Jessica, for putting the topic request form link in the chat. And for those who are on phone only, you can always call me. to relay a topic request, and I will forward that to the policy staff. So, okay, next up is Erin Thatcher.
Thank you, John. Good afternoon, everyone. I'm glad to be here today. I am here to share a little bit of an update regarding the Joint Budget Committee. As you may be aware, the governor's budget was released on November 1st, and the department does have some budget requests incorporated in that. So I'm going to share two things that do relate to PDPPC and our programs, Consumer Directed Attendant Support Services, or CDASS, and In-Home Support Services, or IHSS. So first and foremost, we are looking to request funding to increase reimbursement rates. This is something that we do normally every year, but we are asking for funding to cover increases to minimum wage, especially in Denver, which will be going up to $18.29 in January per hour. And then hopefully the Joint Budget Committee would approve that, but we really don't know anything until the session starts in the spring. Secondly, we did request funding for a request called third-party assessments for nursing services. So what that is, in summary, is it's a way to modernize and streamline our assessments for people who need skilled care. So that isn't just CDASS and IHSS health maintenance activities, that's also people who need private duty nursing or home health. And what we're looking to do is to have one consistent, reliable way to assess a person's skilled needs and get that approved. And we really want to bolster the person-centered approach and service delivery and ensure that people have the ability to choose what works best for them. So that is really exciting, especially with Community First Choice coming up. We will probably see more enrollment in CDASS and IHSS, and this is a great way to get us kind of on a level playing field and get more people to self-direction. So again, those are two things that are in the budget request that the Joint Budget Committee will be discussing in a couple weeks here, coming in early to middle of December. We will provide updates on where things are at as they go through the process. And at this point, I'm not sure if the budget request is online. If I can find the link, I will put it in the chat. Thank you, John.
Thanks, Erin. I'm just checking to see if anyone else put their hand up for the open forum. We do have some time left. And so let me just pause one more time. If anyone has anything that you want to raise, if you're on the phone, you can unmute yourself. Looks like another hand. Is that still Erin? Michelle Morris, excellent. Michelle, please go ahead. Thank you.
Thank you. Erin, this is actually just really quick for Erin. I just want to clarify that I heard you correctly that, excuse me, that you guys will be requesting to increase the reimbursement rates to minimum wage. So currently, like IHSS reimbursement, I think is at like 8.88. You're talking about increasing minimum wage to 15 to 18 per hour, per unit. Just wanted some clarification.
Sure. So we are asking for increased reimbursement rates for HCBS services to ensure that our cost per unit, which is we've got 4 units per hour for those of you who are unfamiliar with our billing practices. So essentially, we're looking to get an increase in order to ensure that our rates are able to sustain increases to minimum wage across the state. So in Denver, there is a higher minimum wage, which will be $18.29 an hour starting in January. And as inflation goes up, the minimum wage goes up in certain municipalities. So we want to make sure we can get ahead of that and increase reimbursement rates so that providers are able to cover that and exceed that.
Thank you.
Does that answer your question?
Yes, thank you.
Okay, great. Thank you, Michelle.
Thank you, Michelle. So seeing no one else, I'll just jump in here. I want to say
John,
that we...
John,
Oh,
this
go
is
ahead.
David Pohl.
Oh,
David
were you
Pohl,
in
and
there? Sorry.
well, I can't find the hand raise on my phone. So,
Oh,
So Aaron, my question is this, is on January 1st, 2024, Denver's minimum wage goes up $1 an hour. And since you put in a budget request that starts fiscal year July 1, you're asking everybody to eat that money for 6 months for a personal care homemaker, because that $1 an hour really translates to $1.20 an hour when you consider all of the aspects of costs that are associated with hourly rate increases. So you got FICA, you got insurance that goes up, I mean, there's so many things that are, we've got family, we've got paid sick leave, there's all of these different things. And so are you going to continue to plan for people to eat these increased costs for 6 months every year? That's my question.
Thank you, David. And I just have to say you did such a great overview of all the things that you have to pay for at the agency perspective. And thank you for that. We know that the Denver minimum wage is kind of off cycle for what our reimbursement rate methodology and structure usually is, with the Joint Budget Committee approving reimbursement rates to increase or change. I think in our larger budget requests, we are really looking to figure out a better way to get ahead of the workforce crisis. So while there is money to account for an increase to workforce-based wages and minimum wage, we're also suggesting a multi-year strategy to address the workforce shortage. And, you know, the reality is we're the second fastest growing state for older adults. We've got a lot of we've got a lot of concern here that providers, in order to be able to provide services, need to be able to make money. And at the end of the day, you know, I think for something like this, I would say keep sharing your feedback with us, and also with the Joint Budget Committee if you have a chance to, because we definitely need support in order to make sure we can get ahead of the rate increases in Denver and other places.
Well, we've already starting to talk with the Joint Budget Committee about whether or not the department is going to request a supplemental to cover the Denver minimum wage. And then Boulder County just is the only other people that have said that they're going to do a minimum wage increase, but it is just up to $15 starting January 1st. So it's not going to really affect the Medicaid program for a while anyway. But there has to be some planning and understanding of how the reimbursement rates work for CDASS, because it's the same for CDASS too. If you're living in Denver receiving personal care homemaker services, that minimum wage goes up $1 an hour and there's no increase in the rate. That puts a real strain on your budget if you can even cover that. So are we just asking people to go without, which is now, I don't think what the department really wants to do, but we got to plan ahead. I mean, we brought this up last year with the department, and yet nothing changed in this budget request. Thank you.
Thanks, David. I'll just mention, I'll share your concerns with Colin. He's kind of the spearhead of the trying to get around, or not around, but try to deal with the Denver minimum wage and other municipality rate increases. And I'll just mention for the group, Colorado allows different cities or municipalities to set their own minimum wage. and it can exceed the actual state minimum wage. So we are aware of a couple of places that this is happening, as David referenced. Boulder County is one of them. If you hear of something in your area that we might not be aware of, please reach out to us, because unfortunately we can't really keep tabs on all the things happening in all the different areas. We're doing our very best, but thank you. Sorry, and I know we're over time, so I apologize. I'll go on mute, David and John. Thank you.
Okay, thanks. We are still a little bit ahead of schedule, actually, but obviously this is an important topic. I wanted to mention the question, and Aaron, how we ought to proceed as a group with this right now, I don't know, but a December meeting. Several years out of the many I've been involved, we've foregone the December meeting for various reasons, JBC, et cetera. So I'm just throwing it out to see, and Kurt, Aaron, whoever, to guide this conversation about, do we meet in December? Are we? It is on the schedule, but obviously I can send out a cancellation notice. That's the logistics. That's no big deal. The question is whether we will have the meeting.
So hi, John. It's Aaron. So I think we don't have a preference either way at the department. I will just say, because of Joint Budget Committee, I know a lot of our staff and advocates and other folks who are involved in that process are pretty busy the first couple weeks of December. That being said, I think if the group would like to have a meeting, and I'd love to hear from Kurt and Kevin what they think, but we could go either way. So thank you.
Kurt, Kevin, your thoughts or questions for the group or whatever? I'm trying to see if Kevin is, there he is. Looks like they're both with us. So I'm not trying to push this, rather just ask the questions so we can all know going forward whether there will be a meeting next month. Kurt and or Kevin, any thoughts on this matter?
Hey, John, it's Kevin.
Hello.
So I am all for foregoing the December meeting due to the JBC and other. It is a busy time of the year, unless there is other discussion on something that is pressing that needs to take place. Yeah, I'm okay with foregoing that meeting.
Got it. Kurt, are you with us? Let's see if he's still, there he is. Well, let me throw the question out more generally to the group. Is there anyone who has a thought about whether we should or whether we should not hold the December meeting? And you can raise your hand in the webinar. If you're on the phone, you can unmute. And by the way, when you're on the phone only, pressing *9 on your phone will raise the hand to your phone number in the webinar. So Kurt does not appear to be with us, so I'm going to pause this. I expect that in the course of the meeting, he'll come back, and we'll see if we can hear from him as well as the other co-chair. So let me just move on my little agenda here. The 2024 meetings invitations will be out sometime during December. We'll also make sure that they're on our Office of Community Living online stakeholder engagement calendar, as always. During 2024, the November and December meetings turn out to be like in November of 24. I know it's a long way away, but the fourth Wednesday is the day before Thanksgiving again. So I will push the meeting to the third Wednesday in November, if we should have a meeting that month. And for December, the fourth Wednesday turns out to be Christmas. So if we meet that month, it'll be the week before the third Wednesday. Otherwise, we're still planning, unless other things happen, to meet on the fourth Wednesday of the month. And finally, I just wanted to apologize. We do have some website work going on. If anyone tried to get the meeting documents for today from our current website, they're not on there because we have a little hiatus of making changes to the website. There's some work going on to fix or redo the software of the website, something along those lines. That's beyond my comprehension. So thank you. I will move us forward then. And the next item is expanding self-direction update. Karina Barrick, and I apologize if I've mispronounced your name. Or if there's a staff member who wants to tee this up. I am looking in the participant list for Karina's name. I don't see it. In the meantime, while I'm looking, Jerry Froning, I see your hand raised. I'm going to call on you. Go ahead, Jerry.
Yes, on the previous topic of the December meeting, whether or not to have it, I
Yes.
thought it would be helpful to wait until after the breakout rooms, because someone may have an issue during the members, families, and advocates breakout room that they chose not to identify right now. And we could, at the second open forum, John, you could, by then would know if there were any issues that might mean a December meeting would be helpful. Thank you.
Thank you, Jerry. I think that's a great idea. So we'll do that. That's great. We'll wait to, I'll bring it up again in the second open forum. We'll go from there. Excellent. I believe we are in search of Karina. In the meantime, let me see if Christine can be flexible and jump in. We will cover the Community First Choice CFC updates.
Of course. Hi, everyone. Christine Dos Santos with the department. I don't have any big updates for CFC this month, but I am going to urge everyone to take a moment and look at our SPA, our state plan amendment document draft that is on the internet on the webpage, and provide us any feedback. We are still looking for as much feedback as we can for this. And I'd also love to urge members of PDPPC to come to the Community First Choice Council meeting, meetings in general, but our next one is going to be December 6th at 6 a.m. At 10 a.m., not 6 a.m. We would just love to see some more members and participant directed members coming and attending and providing us feedback and insight as much as possible. So if you haven't already had a chance to come to one of our meetings, I would suggest stopping in. You can stop by at our next meeting where we will continue to discuss that SPA document. There's a few sections we didn't get a chance to get through during our last meeting. So we're going to be going through that and then opening up to any comments about any of the sections in there and any general questions you may have about Community First Choice. I will put in the chat a link to our SPA document as well as the link to our stakeholder page where you can get meeting information and as well as previous month's agendas and presentations. And I'm happy to take any questions if anyone has any.
Thanks, Christine. Any questions or comments for Christine? CFC update.
Renee?
Thank you, Renee. Go ahead, please.
Where do we find the Community First Choice? Where do we find information on that at all?
A great place to start, and thank you, Renee, for that question. A good place to start is the website. For CFC, we do have an entire website that's dedicated to explaining what CFC is, what the department has in store for CFC, as well as our stakeholder page. It does have links to all the documents and presentations we've ever put on during CFC Council. I did put that link in the chat. And I know that you're not on the computer, so maybe I can have John email you, if that's possible, a link to the website. So that way you can get in there and take a look.
Yeah, that would work great. Thanks.
Where is the spa, the draft spa located on the CFC website?
So it's on the stakeholder engagement page. It's the first link under the November 1st meeting, but I also put the link in the chat too. So it's in the chat for everyone, so you can just click there. And then I see Erin put in, she asked if I could give a brief explanation of what a SPA is. So a lot of us are really familiar with our waiver amendments, right? Our waiver documents. The SPA, or the state plan amendment, is much like that, but with just for our state plan. They are a little different in regards to the amount of information that goes into them. There is far less that goes into a state plan amendment as compared to the waivers and the waiver documents. But in the state plan amendment, you'll be able to find, at least in this one, what services we are intending on bringing over to CFC from waivers, how we're intending to structure those services. We have some information about provider qualifications, about case management and assessment, as well as some of our quality assurances and quality measures that we are intending to put in place for CFC. As a reminder, this is just a draft. We have not submitted to CMS at this point. CMS hasn't had a chance to take a look at this document. It is most certainly still in a draft form. So that's why we're looking for feedback. So if we need to make any changes, that we can do that before we get it over to CMS.
Thank you, Christine. Anyone else? Okay. Looks like that's all for now. Thanks, Christine.
Thank you.
Okay, we are doing a little pivoting here. So next up is item number 8 and no, item number 7 and Jessica Corral.
Hi, everyone. Just a quick update on the request for proposal process, our RFPs. We are still currently in the, well, as of last month's update, the bidding process has closed and we are currently in the evaluation period. We do expect this to extend through most of the month. And then from there, the bids that have been chosen based on the evaluation process will be communicated out to those offers, to those contractors. And so I do anticipate, and this can change, but I do anticipate being able to share with stakeholders which FMS and training and operations vendors have been chosen early next year. Thank you.
Very good. Any questions, comments? There we have one hand raised. That may or may not be about this. I'm not sure. I wasn't monitoring before. Anyone else? Kurt Wolf, I see your hand raised. Was that from before, sir? Sorry.
No, it was for just now.
Okay.
Hey, Jess, I was just wondering, any idea about how many FMS vendors the state's going to try to move forward with? Is it going to be still 2? Are we going to shoot for 3 again? Just any thoughts on that?
Yeah, so that was described in the FMS RFP, Kurt. The goal is to have 3 FMS. That's what the programs have had historically, although we don't currently have now, as all of you know. So that would be our goal. For the training and operations vendor, we are only going to be contracting with 1.
Okay, thank you, Jess.
Thanks, Kurt.
Thanks very much, Kurt. Anyone else? Seeing nothing, hearing nothing. Okay, bear with me. still in the middle of our pivot. Super. So, Karina, thank you for joining us, and we are on our item number 5, expanding self-direction update.
Hello, everyone. Karina Barrick here. I apologize for not being available earlier. I just wanted to give a brief update on the self-directed evaluation study that we've discussed a couple times with this group. We're continuing to work with Mission Analytics on looking at self-direction for respite, home modification, non-medical transportation, and acupuncture, chiropractic, and massage on the CIH waiver. We have started stakeholder engagement and have been able to collaborate with the ongoing work group starting this week. We've met with the CFC policy team, FMS vendors, HCPOF subject matter experts, and we're in the midst of finalizing the analysis process of the history of self-direction in Colorado. We do plan to continue to give updates to this group as needed, and I'm happy to take any questions back or answer them if I can.
Folks, if you have a question or comment for Karina, you can raise your hand in the webinar. If you're on the phone, you can unmute, press *6, give me your name, or *9 to raise your hand by phone. I am seeing none. Hearing none for right now. Oh, wait a minute, I take it back. There is a hand raised. Oh, that might once again, Mr. Wolf, I'm not sure if that was from before. Do you have your hand raised again, sir?
No, it's not.
Okay,
I hate to be the only one. Yeah, I'm ready. If anyone else want to speak up, I can wait.
Oh, well, there's none else. Please go ahead, Kurt. That's great.
So I just want to say, as chair, anyone out there as stakeholders?
I'm sorry, Kurt, you're breaking up a little bit.
This is your time to engage. If you have any questions or concerns, or just ask away. Number 2 is, I'm sorry, I don't have my Bluetooth on here. Let me try something if you give me a second here.
Sure, you were kind of breaking up there.
Connect is not connecting. I don't know why. All right, so I'll just keep it short. Has anyone considered adaptive exercise in this request for expanded services?
Great question, Kurt. Thanks for asking that. We have not included it in this set of services. The priority of the 6 services listed was outlined through some previous engagement done earlier this year. So we are focusing on those 6 for this project specifically.
Is it too late to add that in at all?
At this point in the study, we're about, let's see, we're about 5 months in. So we've got about maybe 8 months left. A part of how we selected and move forward with the study is being able to talk to our vendor, in this case, Mission Analytics, what we're expecting and what we really want to dig into. I wonder, Kurt, if we could have a separate discussion on what your thoughts were more specifically about that services. Another thing to keep in mind is that the services we're looking at are existing services. So I think with the thought of adding in a new service, it would change the dynamics of this project and wouldn't necessarily fit into as an addition, but I definitely think it would be having a conversation.
Okay, let's talk offline on that, Karina. I think there's some things they might want to consider as a pilot program anyways, but I don't know. All right.
And I'm going to drop my email in the chat so everyone can access it. For those on the phone, it's my name. I'm Karina, CORINNA .Barrick, BARRACK at state.co.us. I also just want to remind folks that we have the ongoing work group, and thank you so much to those who have already partnered with us and If at any juncture you are interested in partnership for the duration of this project, we'd love to have you.
Okay, thanks, Kurt. Bobby Christensen, please go ahead. You can unmute if you have your computer audio, Bobby, to unmute that, or if it's your phone, *6 to unmute.
John, I accidentally put my hand up. I didn't mean to.
Okay, well, it gives me the opportunity to say hello. Okay, thanks.
Thank you.
Thanks, Bobby. Anyone else? Okay, seeing none. Karina, thank you.
Thanks all.
And I will move us to item number 8 then on the agenda. I believe, Aaron, you're going to be covering this.
I sure will. Thank you, John. So this is the overspending protocol proposal update. And so I just wanted to start by saying I don't have a great update today. I don't have an update. So, but I'd like to go into why we don't have an update and when we might be able to expect one. So as an overview, we received a recommendation to remove the cap on overspending if you have reserves. And that recommendation came in several months ago, and my team has been working on it extensively and has a really, really good write-up done. It is currently in review and e-clearance with our leadership, and that's kind of where it's stuck at this moment. You know, I think at this point, we don't really have an update, but I'm hopeful that we will have an answer in the next week or two. And when we have an answer, we will be able to send that out to the group formally and use the John Berry email list probably if we're not going to meet in December. If we do meet in December, we'll send it out with all the other documents and share at the meeting kind of what we came up with. And with that, I would like to apologize that it's been quite some time and we have been working on it, but you know, that still doesn't mean a lot when you're trying to, you know, get policy changes enacted. And so I do recognize that this is a delay and I apologize for that. I'd also just like to share that when we get a recommendation that comes in, there's an extensive amount of work that our team does, and it depends on what the request is. In the case of the overspending protocol, we have to do a review of all of our state and federal rules. We have to chat with our vendors. We have to look at contracts. We have to do a lot of background work to make sure that we're getting like the right answer and we're doing our due diligence to get the most appropriate response back to you. And in addition, if this is something we're able to enact, we put together a very comprehensive plan of how to get it done. So unfortunately, this has taken a little bit longer, but I do commit to you that you will have it in the next couple of weeks, as soon as it's cleared by our leadership, who has to approve on any policy decisions we make or changes, or even if it's a no, they have to agree with that. So we will let you know as soon as we have that back. So thank you all for your patience and understanding. Any questions on this at all?
Folks, if you do, you can raise your hand in the webinar. If you're on the phone only, unmute *6 or *9 to raise your hand by phone. Anyone? Seeing and hearing nothing so far, Aaron.
Okay. Well, thank you, John. We'll be in touch as soon as we can. Thank you.
Okay. So I'm going to ask to brainstorm out loud here with Kurt, Kevin, Aaron, and team. We are early. We have about 16 minutes until the break was scheduled. Here's a proposal that we start the break and we come back at 2 to do the breakout rooms a little bit earlier. I believe we really are not at this point able to move any of the items from after the break to now, because the reports in the breakout rooms cannot occur without them meeting. And we don't really have a URUM report for this month. So Kurt, Kevin, folks? How does that sound?
John, that sounds good to me. This is
Okay.
Kurt.
Same here.
All right. Thank you. So folks, we will pause. We will be back at 2 o'clock when we will begin the breakout rooms. They'll go for 25 minutes and we'll go from there with everything else. See you in 15 minutes. Thank you.
Can never figure out how to get to a breakout room. Hello.
Hey, Jerry, we're taking a 15-minute break and then we'll do the breakout rooms in 15 minutes and we can help you with it at that point.
Okay, because every month there's nothing on my screen that says move to breakout room. So I don't know how that happens. So I'll see you in after the break. Thank
Okay,
you.
sounds good.
All right, folks, it is 2 o'clock and we are back. Thank you. The second portion of our meeting today. And we are moving to the breakout rooms. I believe that Jessica is going to share a screenshot, some information regarding the breakout rooms.
Hi, everyone. Yep, I want to take a little bit of time to walk through the controls so that hopefully this is a little bit clearer of a process. So hopefully you can see my screen. It has a few screenshots of what should be the participant view of the Zoom controls are if you're connected through the online platform. So as I open up the breakout rooms, what you should see at the bottom of your screen, in between the record button and the reactions button, is an icon that says breakout rooms. And if you click on it, it should open up either a menu or a pop-out window that shows you the in progress rooms. And then to the right, a button to join the room of your choice. It will ask you to confirm joining that room with another pop-up. Of course, as we say every month, if this is still not working for you, or you just prefer that we help you get into the room of your choice, we are able to do that and happy to. Unfortunately, those of you calling in,
I need help. I keep clicking on the join and the confirming and nothing happens.
Okay, Jerry, not a problem. Which room would you like to go into?
The room 1.
Got it. As I was
Renee,
saying, the call-in participants need to be assigned. This is not available to them. So Renee, I hear you speaking up. Which room would you like to go into?
the members.
Sounds good. All right. I'm going to stop sharing my screen and hand it over to John as I go into
Okay.
the FMS and training room. If you have any questions, you can always feel free to reach out to me or to the unit and we can try to troubleshoot a little bit more with you individually. Thanks, everyone.
Thank you, Jessica. This is John Barry again. So I do see Ron, your number, Ron and Tracy. If you want to be put into a room, I can do that. Are you with us, Ron? While I'm waiting, anyone else?
Yeah, that's like group 1.
Okay, sure will. Anyone else?
This is Dolores.
Okay, Dolores. And
I would like room 1 as well.
okay, and that what are the last 3 numbers of your phone number?
7364.
Got it. Anyone else? Well, okay, I am standing by. If anyone else wants help to get into a breakout room, otherwise they are 25-minute long groups. So we started, I would say, got people in there at 2:03. So I will call it at 2:28. And I will close the rooms at 2:27 so that they shut down by 2:28. Okay, everyone. Looks like we are back from the breakout rooms. This is John Barry again. And I will move us on to subcommittee and work group report out. I believe we do not have URUM report. That's correct. Anything from the IHSS group? If
Yeah,
not,
thanks,
then-
John.
Go.
Yeah, we just had our breakout room, and we tend to speak right to the very end. And so thanks, folks, for your robust conversation again today. Really, we just had some kind of in the moment questions come up about member eligibility and some issues that might be popping up for folks with their county eligibility. And so really just wanting to make sure that people have a platform to be heard and that that information can be shared with the people that will need to hear those stories. And then just a couple of quick just confirmations about when things might be required or who's required for what form. And so we were able to confirm that information as well. So overall, once again, a productive conversation that we appreciate people showing up for, and we'll see you all next time we meet. So thank you.
Thanks, Emily. Anything from the FMS group?
Hey, John, this is Danny. I can do our brief report out. We didn't have a ton of questions or hot topics to discuss today. We did a quick check-in on case management agency transitions, and that was about the gist of it. But I do just want to encourage anybody that if they do have FMS or training vendor or case management questions or concerns, the breakout room is a great place to bring those. So in our future meetings, feel free to join, and we'd be happy to indulge in that.
Thanks, Danny. Excuse me. I beg your pardon, everyone. I see Jerry has her hand raised. Jerry, go ahead, please.
Yes, to revisit the topic of whether or not to have a December meeting, that I brought that up at the #1 members family advocates breakout room, and I'm going to defer to anyone else for their feedback. I don't have a strong opinion either way on the December meeting, but there was some discussion in our breakout room. So if anyone else wants to state why they'd like to have a December meeting, this would probably be the time to do it. And we did have a lively discussion on other topics that could come up either in December or in January, etc. So thanks.
Thank you, Jerry. With her invitation there to others from room #1, if anyone else wants to speak, they certainly can. You don't have to. Of course, we do not make a habit at all ever of asking for a report out from the Members Families Advocates group, but on this particular question, if anyone else has anything to say. Let's see, Kurt Wolf, see your hand up.
Actually, I saw Robin had her hand up first, John.
Robin, oh. I don't
Yes,
see.
right.
Go ahead. Thank you, Robin.
Oh, I put it down because I thought you were going to call on me. So yeah, I guess I would say yes, we would like to have a December meeting. There is way too many changes and issues as a result of those changes happening to just skip a meeting. And I think a lot of what happened in the group too is there's certainly some frustration about follow-up. I mean, there's been questions out there. I mean, we never got any follow-up on the attendant in the hospital thing. We've just been put off, and it's been almost a year now, and there's been no real answer to our questions. So maybe December is a good time to have a discussion, more than 2 minutes, John, of the meeting, what it's for, maybe restructuring the meeting and making it more meaningful for many of us.
Thank you, Robin. Kurt, did you want to go ahead?
I'm just going to ditto everything Robin said, and it sounds like we have some things also we're looking to address more stakeholder involvement and how we're going to make that happen. And so I think those are some things we want to maybe include and be more specific in the group so we can come up with some good solutions to get more people involved, as well as kind of an action plan, whether it's constant contact, somebody to get more discussions. So I think we need to plan on probably a December meeting. Hey, Aaron, I see you got your hand up.
Hi, Kurt, and hi, everybody. I guess one question would be, and I'm not sure if Kurt, you've taken a good like list of notes from what you all talked about, but it would be helpful for us in planning next, well, not next week, but the next planning call we have. It'd be helpful to know exactly what we want on the agenda. And there are a couple ways we could do that. Kurt, if you have good notes, we could definitely take your notes. If anyone else would like to contribute these topics so that we make sure to get them on the agenda, that would be very helpful. You can email them or put them in the topic request form. But I would say on the follow-up end, like this is one component that we're going to need a little bit of help because we're not in the group where this was discussed. So that's my ask. Thank you all.
Thanks, Aaron. One thing I was thinking about when we were just wrapping up is I think there's a couple of people that made some pretty good points in the meeting, and we might want to consider inviting them in part of the planning meeting. We could talk about that certainly offline, okay?
Okay, thank you, Kurt. So just a reminder to Kurt and Kevin, the first Wednesday of the month, we're doing our prep call as we do every month, and great. I will move us to the open forum number 2. It is a 10-minute period, and I will ask now for hands raised, or if you are on the phone only and want to unmute your phone to give me your name, you can do that now, *6, to be added into the speakers queue for the open forum. We have 2 so far. Anyone else? Anyone from the phone? Okay, hearing none. Just mix it up a little bit here. Let's start with Alejandro. We haven't heard from you in the general meeting today yet. Please go ahead. Thank you.
Yes, hi everybody. This is Alejandro Contreras, Senior Account Manager for PPL. I just wanted to announce real quickly that from December 8th through 11th, our systems Better Online and Time for Care will be down for maintenance. Time for Care will be functioning in offline mode, so any timesheets still can be submitted, but they will not be processed until the Monday, the 11th. So just wanted to put that out there. There will be some messaging on our website and on the Time for Care app to let members and attendants know about this maintenance. But just wanted to quickly announce that. If you have any further questions, please reach out to me at my email.
Thank you, Alejandro. I forgot for the moment he's with PPL, otherwise I would have called on Jerry first. That's our tradition in this group. Sorry about that. Jerry, go ahead, please.
Yes, I have a question. What is the rules on access to the planning meeting? And then I would need a date and time and link and all of that. Can anyone attend that, or is that closed to just Kurt and Kevin and people from HICPA?
Well,
Does anybody have an answer?
Jerry, this is Kurt. We'd like to try to keep it to not a lot of people. We don't want to have a huge, long discussion, but we really kind of focus on what's going to be talked about and about how much time each topic needs, and then assign people to facilitate that particular part. So I don't want to have it completely open to everyone. If you have a specific subject that you want to talk about, I want to make sure I'm going to give everyone my phone number. In addition to that, you can have that topic request form at the state, which could be, just take the time to do that. But you can also call me at my number, and if I could write it down, I'll share it with everyone right now.
No, that's okay. Just you to know. I'm just.
It's 720. And it's on the website as well. Just give me a call at 720-220-920. So write that down, everyone. Also, it's on the website. All that training manuals in the back of the training manual. My number's there. My email address is there. So anyone who wants to do that now, I'd rather that we sort it out and we don't have a discussion of what we should have. And we really want to keep folks on the agenda and then plan for that moving forward to the month. So we get to our December meeting, we could have a good, robust discussion and specifically start addressing issues one at a time with everyone possible involved. All right.
Thank you.
Thank you for putting my number up there, Michelle.
You're welcome. Your internet's cutting in and out a little bit, so it was getting kind of cut off. So thought I'd help you out.
Okay, I apologize for my background noise. I think I accidentally was in the background there. Are there any other items for this last open forum of the day? Okay, hearing none. Let me just ask a question of Kurt. I got a little distracted, as I said before. My son walked in the room and all of a sudden, but we have up to this point had the prep calls, as we call them, although they are online, obviously, but to involve the co-chairs and staff over the years, with the idea that the co-chairs would be bringing forward in a representational way requests for topics. We'd review what occurred. When you spoke a few minutes ago, Kurt, I think you said, let's talk offline. I thought that was where it was left for the moment. So I'm a little unclear how we're leaving things now about it. And I think it's a little awkward and tricky, but is it your understanding, Kurt, that you're inviting other people to the prep call for in relation to the December meeting?
What I want to do is maybe consider having, what I would like us to consider is having maybe one or two other people on the prep call as well, just to help kind of brainstorm topics that we probably should be talking about. We seem to be kind of stuck in a rut. So definitely, I'll send you guys an email and discuss that at a separate time. All right.
Well, that's fine, but I do want to say something out loud with the group since you've brought it up, because this is why we originally decided, along with the group, by the way, years ago, that we would have the co-chairs be there, because the question comes up, Kurt and everybody, well, if other people are invited and we're saying only a few, well, who gets to be there and who doesn't get to be there? And that gets complicated and awkward pretty quickly. The role of the co-chairs made it very clean that they have been, you guys, and before you, Linda, Andre, for example, I think Chanda in the past, whoever, have been representatives of stakeholders in that moment to help us remember what occurred, what people want, how we should plan meetings. So it gets tricky pretty quickly to think about who decides who else gets invited and who doesn't. That's the complication as I see it. So with that, we should talk offline and I believe sort this out. In the meantime, I see Michelle has her hand
Yeah,
raised.
let's talk offline about it.
Yes. Michelle, do you have an item for the open forum?
So just kind of expanding on this topic, I am relatively new to the PDPPC meetings, and I respect the process of having the co-chairs. I do think that we need to brainstorm, and I'm not sure if that's where Kurt's thought was, but looking at those planning meetings, you know, since this is participant direction, consumer directed meeting, we need to make sure that there is representation from every aspect, a diverse across the board representation of members that are accessing these PDPPC programs, to include parents of children who are accessing IHSS and will potentially be accessing CDASS in the near future. So I'm going to throw that out there as far as a brainstorm is maybe adding one or two more people to either the planning or the co-chairs that really represent the diverse population that these two programs serve.
Okay, thank you for that. We have another hand and then I believe we are going to wrap it. Bobby, please go ahead. Bobby Christensen.
Bobby, you are muted.
I wanted to mention that Kurt did say in the breakout room that before a certain individual is invited, their request or topic idea will be reviewed, because he mentioned that they must fill out a form first. So I think he deserves all the credit for trying to make good changes.
Okay, thank you, Bobby. So that brings us to the end of the meeting, folks. And next month we are meeting. It is the third Wednesday of December. And that actually has been in the invites that I sent out at the beginning of this year, way back in whenever it was, January or December of the prior year. So if you accepted those invitations, that's what you have on your calendar. If you don't, you can certainly access the meeting information on our online OCL stakeholder engagement calendar, or you can contact me as usual. So thank you very much. And we will hear from you. We will see you all hopefully next month. Take care, everybody. This meeting has been recorded, so we'll get you the link as soon as we can. Bye.
Thank you.